So just to make something clear, in the new WHO, which will be coming out for the classification of endocrine organ neoplasms, the word variant is going to disappear because the word variant is used for a lot of molecular stuff. So we're going to call them subtypes of papillary thyroid carcinoma. So let's make that clear. So this actually, the first cases were reported from Mayo Clinic by Dr. Lloyd in 2010. And this was really a seminal article, which did get a lot of press, but also a lot of pushback because everybody thought it is just a little growth pattern that is, just caught an eye of a pathologist who's probably just wants to make another entity. But what we also realized that when the tumor has these small structures, and it almost looks like a tiny flowers with a lot of petals, if you can consider, thinking of in a layman terms, and if you do not do pathology every day, we have recognized these type of structures in other organ systems, like in urinary bladder, which have these micropapillary type carcinomas, and ovary, and even in the breast and lung. And what we recognize that when these tumors have these small papillary structures, they tend to be more aggressive because you can just imagine mechanically they can easily snip off, can go into the lymph nodes and blood vessels. And this tumor, when it was described, some of these cases were already associated with other aggressive subtypes, like tall cell subtype is the most common where you see these tumors. And as you can see on the high power, which is the bottom right picture, my screen, the right, there is these very smaller structures, but if you see the nucleus, it is kind of pushed to the edge of the cell. And that what is known as the hobnail appearance. And as you know, if what is hobnail is, if you go back into the Western times, you can see how the nails were, or sometimes what the cowboys kind of wear on their boots. And that's what comes out, the term comes out from. So what we see these tumors that they can have multiple molecular alterations, which will be talked later in there. They tend to have increased lymph node metastases, recurrences. Now you make the diagnosis, you call something all hobnail subtype of papillary carcinoma when 30% or greater of the tumor mass that is examined on the slide shows hobnail features. And these tumors can be a little bit cystic also sometimes, but they are what I have seen mostly, that they are very much associated with other aggressive subtypes. So you kind of have a mixture. You can have a classic variant as a nidus, you have a tall cell, and then you have a hobnail. And lymphatic spread or angioinvasion, you can very easily, and even perineural invasion, you can easily see in these tumors. But they are thyroglobulin positive, they are TTF1 positive, and they are also Paxate positive, which we use markers to confirm the follicular derivation.